This comment took me to North Carolina. In rural North Carolina, they did away with labor and delivery about 4 years ago, and it's been awful for the women of my area. Erlanger CEO explains why Murphy Labor and Delivery is closing. Erlanger Western Carolina Hospital in Murphy will close its labor and delivery unit next month. BPR spoke with hospital CEO Mark Kimball about how the decision was reached. Erlanger, a nonprofit Chattanooga-based health system, purchased Murphy Medical Center in 2018. When the hospital was purchased, it was in trouble, says CEO Mark Kimball. He adds, decision like closing labor and delivery will hopefully keep the hospital profitable. I do want to point out that North Carolina is a state that does not accept Medicaid. We looked at a number of factors in our service area. In Murphy, deliveries have been declining for a number of years. Kimball says that in the last 5 years, the hospital has averaged 120 births, as Cherokee County has about 300 births total per year. The other mothers headed to Blairsville, Georgia, or Harris Regional Hospital in Sylvia to deliver. Blairsville is about 20 miles away. Sylvia is about 65 miles to the east. So you have to ask yourself, how could you possibly build this business? Can we capture more of the business? This small number of mothers choosing Erlanger is one of the reasons it's closing its labor and delivery unit. Kimball says there are more aging people who are in need of care in Western North Carolina, but the number of primary care doctors, especially those who are accepting new patients, is dangerously low. As you know, in this area, there's a lack of primary care physicians, and that's why that's what we really went after hard, to be able to build that primary care base. Everybody needs a primary care physician. So I do just want to highlight the orange states have not adopted Medicaid. And these are some states that are experiencing closures as well. I just spoke about Mississippi. North Carolina is talking about closing. That they closed this hospital. This hospital, the whole hospital system is based out of Tennessee. So they're not accepting Medicaid. Impacts low-income people, and it impacts the ability to get government funds to fund hospitals. But Medicaid is back in the spotlight in North Carolina. They are actually looking to expand Medicaid, and they didn't want to do it when Obama was in office because for whatever reason, but there are 600,000 people in North Carolina who would benefit from Medicaid expansion, and so will those hospitals that receive those funds. So we'll see if this is the state that accepts it now. Anyways, jump in the comments section, tell me what you think, like, comment, share.